देश के राज्यों में स्वाइन फ्लू के बढ़ते मामलों से हड़कंप मच गया है।
Hello friends, my name is Dr Naman Ajwani. I am a consultant chest physician at Zen Multi-Speciality Hospital, Chembur. And today we will be talking about swine flu. Swine flu is a disease caused by influenza virus, and it mainly affects your upper respiratory tract, that is your nose, mouth, pharynx and larynx. The most common signs and symptoms of swine flu include fever, cough, runny nose, stuffy nose, sneezing, sore throat, headache, myalgia, generalized weakness and fatigue. In some patients who tends to be uncontrolled diabetics, or in patients who have chronic heart, liver, lung or kidney patients, or who are immunocompromised such as cancer or HIV patients, or at extremities of age, we see that influenza virus can also affect the lower respiratory tract, like causing pneumonia, acute respiratory distress syndrome, causing respiratory failure, or even heart or nervous system. Now, influenza mainly spreads via airborne or droplet infections. And what we have seen is what makes it so special is that influenza has 4 variants: type A, type B, type C and type D. Type D is the one which mainly affects the cattle, hence it does not have any human significance. Type C is the virus which affects mainly in the early childhood, that is in less than 6 years of age. Type A and type B are the viruses which affect all age groups, can cause a severe disease, and it has a high mortality and morbidity. Now, type A and type B are the viruses which cause yearly epidemics and decadally pandemics. Why? Now, type A and type B are the viruses which normally has 2 proteins, H and N. You must have always heard that whenever we are talking about influenza, we mention H1N1 or H3N2. So what these H and N are? H and N are nothing but proteins which are made and secreted by the viruses in order to contact our human cells, at the same time evade our immunity, and that is what this H and N proteins help them to spread and cause a severe infection. Now, these H and N proteins have 2 abilities. One is that they can change their structures, a part of their structure every yearly, and hence they can cause yearly epidemics, but they can entirely change the entire structure, which can cause probably pandemics just like our swine flu, Spanish flu, Hong Kong flu and avian flu. Now, what precautions do we need to take if you have swine flu or you are probably having signs and symptoms of it? Firstly, it is always better that since the virus spreads via air droplets and airborne, less likely it can also spread via formite-borne, it is better to have contact isolation, meaning that anybody who has symptoms of swine flu should isolate themselves and should reduce the transmission. They should follow proper cough etiquette and should also wear mask. There should be less of overcrowding and there should be good ventilation in areas where overcrowding cannot be prevented. There are also antivirals which, if started in the initial 72 hours, can really benefit and change the course of treatment. Rest of the treatment is mainly symptomatic. Make sure that your comorbid conditions such as diabetes, asthma, chronic kidney disease or heart disease are always under check and their medications are strictly followed. Make sure that you also have taken vaccinations in patients who are immunocompromised. There are 2 vaccines which are available. One is an intranasal vaccine which can be given in children, and one is a killed vaccine which are intramuscular vaccines which can be given in adults. Thank you.